Good morning, good afternoon, good evening, wherever you are, and welcome to this third session of this TechNet 21 webinar series on temperature monitoring, keeping a cold chain cold. Today, I'm very pleased to welcome our guests who are going to discuss how to get the most out of your real-time temperature monitoring data. We have with us Schoevers, technical specialist from UNICEF, Jalia Nanfuka, project manager and CCOP focal point at GAVI, Ranjit, Dhiman, Supply and Logistics Manager at UNICEF, Bonaventura Nestory, IVD Tanzania, Dr. Gurahan, National EPI Director in Afghanistan, Abdul Mateen Husainkhil, National Cold Chain Manager at EPI Afghanistan, Dr. Mohammed Wazir Sadiqi, UNICEF Afghanistan, and Ifeoma at UNICEF Afghanistan. You can ask your questions during the presentation in the Q&A box or in the chat box. Please use the Q&A box preferably. If you have any technical issue, you can use the chat box and we'll help you. I will help you as much as I can. All your questions will be answered by the panelists after the presentation during the Q&A session. As usual, this session is recorded and we'll share the links to the video as well as the slides by email and on the TechNet 21 website. I will share the links in the chat box during the presentation. Yaku, the floor is yours.
Thank you, Alex, and hello to everybody else on the call. Welcome to this session on remote temperature monitoring devices. Let me quickly just give you an overview of the session here. We'll spend a bit of time in the beginning talking about what is remote temperature monitoring. Then we'll dive into some country experiences where our colleagues from Tanzania will share their experiences, followed by our colleagues from Afghanistan that will also be sharing their experiences with RTMDs. And then we'll end off with 20 minutes of Q&A at the end. So next slide, thanks, Jalia. So let's start off quickly and just have a brief overview of what is a remote temperature monitoring system. So as you can see on the screen here, a remote temperature monitoring system are typically installed on vaccine walk-in cold rooms or refrigerators. The sensors are placed inside the storage compartment that takes temperature measurement readings every couple of minutes. And that data is then displayed on a screen, but also transmitted via a cellular network to a cloud data storage where you can access the data on a central dashboard. So what these systems do is when an unsafe temperature is detected, that system will automatically transmit an alert via SMS or email to the appropriate assigned personnel. And this is one of the big benefits of a remote temperature monitoring system. It allows proactive action from the end user to ensure vaccine safety. It also gives you a better awareness of your cold chain to see if there's any maintenance or repair that needs to happen. And it also informs your future-looking procurement decisions on which type of equipment you need to procure. Next slide, thanks. So as I already said, with these remote temperature monitoring systems, you typically get a dashboard where at a central level, you can easily review the data that is coming in from all over the region where these devices are installed. So for instance, if you look at the top right hand of the screen here, that is just some fictional data from Tanzania here. Bonaventura will speak about real data a little bit later on, but this is just fictional from our side. This just shows you that you typically have a map view with the locations of the RTMD shown on that map view. And it will show you whether or not the system is in green or in red, red being, of course, bad, and showing that there's some action needed. You'll also get the ability to download the data into report forms. As you can see on the right-hand bottom, you can see a detailed graph of the temperature data. You can see in the middle where the sensors are installed inside a particular piece of equipment. And then you get summary data as well that gives you a big overview of what's happening with the system overall in the country. So let's talk about where RTM systems are typically deployed. So these systems are a bit more expensive and complex than the systems that we were referring to last week, the 30-day temperature recorders. And due to the higher cost and the complexities, they have historically been deployed at vaccine storage sites where you have a high volume of vaccines going through it, and where there's a higher risk and value of vaccines being stored. So here we're talking about the national vaccine stores, the provincial, district vaccine stores, as well as the refrigerated vehicles. But what we have been seeing lately is that there's increased interest in seeing at a global level what is happening to the vaccine cold chain, and also at a country level due to the difficulties in reporting the data upwards. So now we're also seeing that it's being rolled out at large scale to health center levels, into refrigerators and freezers as well. Historically into walk-in cold rooms, but now also refrigerators or freezers. Next slide, thanks, Jalia. So what do you get as part of an RTM system? So you'll get the hardware, which is the base unit, all the sensors that plug into it, the power supply, etc. You'll get a subscription, which is normally valid for a year, 3 years, or 5 years, and this includes all the licensing, all the communication costs. If you select a global SIM card, you get the cloud data storage where the data is stored online, and then the standard subscription services. And at the end also you'll get installation services or training services as well. So just some factors to consider when you order an RTM system, or if you're evaluating an RTM system. Firstly, you typically need to think about the application, whether or not this RTM system will be going towards a refrigerator, where you'll typically just need a single sensor, or if it'll go into a walk-in cold room where you may need multiple sensors. Talking about the sensors itself, you have a choice between wired and wireless sensors. Wired sensors means that you don't have any battery to replace on that sensor, but you have to run a wire all through the facility to get to the refrigerator or walk-in cold room. Whereas wireless, you don't need to run any sensors. So the installation is quite a bit easier, but these sensors do need to be replaced regularly due to the battery life of the sensor. Then talking about the power, not so important, but just to note that you have systems that are powered by mains electricity, and they're a little bit more susceptible to power damage, etc. Then you have battery-powered systems that doesn't need an external power source. They're immune to power damage, but they typically cannot support very frequent data transfer. And then lastly, but not least, is the SIM selection. So you can either use a local SIM card or a global SIM card. Local SIM cards is what you would procure in country, and these are typically pretty cheap, but this needs to be managed by the customer. And in our experience, you do have a lot of administrative effort that needs to go into managing these SIM cards and making sure that there's always enough data available to enable the SMSing and the data transfer. Global SIM cards, fully managed by the supplier, and it's typically, in our experience, more reliable than local SIM cards. More costly, unfortunately, but definitely more reliable and easier to manage from a country point of view, in our experience. Next slide, thanks. So here I'm just quickly going to run us through the different types of devices available on PQS. So here you can see we've got 7 devices listed here. The devices from Beyond Wireless, Nextleaf, Berlinger, Zero, Hire, and Ikaya. And I'm not going to spend a ton of time here. This is just to maybe give you an overview of the systems. These first systems are all wired sensors. So it means that you have a wired sensor running to the device. The measurement range here depends on the type of sensor that you order with the device. So you can see typically they go down to -40 degrees, but some suppliers do have the capability of going down to -200 degrees Celsius, and therefore also monitoring ultra low temperature freezers as well. So the next slide, please. Thanks, Jalia. This is just an overview of the wireless RTMD systems that is available on PQS. So what you can see here is, especially if you look at the number of sensors reported here, the wireless sensors or systems can at least support a lot more sensors than the wired sensors. Jalia, maybe if you jump back to the previous slide for us. If you look at the wired sensors, wired systems that we're talking about here, you can see typically between, let's call it 1 and 16 sensors that these devices can support. If you go to the wireless sensors, you can see 50 plus for all these systems. One thing that we do have to call out here is the battery life. The sensor battery life, for instance, you do need regular replacement of the sensors on these wireless systems. So you have the Berninger Smart Line, the Blue Lock system, and the higher U-Cool LoRa. And on all of these, you need either sensor replacements or battery replacements on the wireless sensors. Next slide, please. Okay, back over to you, Jalia.
Thanks, Jaco, for the overview. So these next few slides are looking at some of the challenges observed with RTMDs. So first being the fact that given that we have a range of manufacturers available, we have different RTMD platforms within countries. So given if a country has invested in different systems, a country ends up with different RTMD platforms. So it's very difficult to comprehensively look at the performance of a particular country from the different with equipment from different manufacturers. And so our countries would need to look towards integrating either the data within existing system to have that visibility across the board. And then you have RTMs developing really very fast. And as we've seen that countries that are investing more in these systems, but one of the challenges that is being noted right now is the fact that ability to use that data is still a challenge, basically in terms of health workers being able to use the data that already exists in these countries. And sometimes in some cases, countries, even if the systems are in existence or even if the systems are available at country level, having access to the data itself is a challenge. And as we see more investments coming in, countries buying more RTMDs, you've seen with the COVID response, there's been a big push also to, under the COVAX support to make sure that, you know, at a higher levels where these vaccines are stored, RTMDs are part of the equipment that is procured. So we're seeing these systems being brought down to countries, but challenges in healthcare workers being able to use them or even access the platforms still remain. And then as Jaco already alluded to, the high cost for maintaining the subscriptions to make sure that the data continues coming and countries can use them sometimes creates a barrier to scaling up the systems within countries. Then, just a second. Then the other challenge we face is also around limited training of end users. Again, it links back to, you know, how have healthcare workers received training? Are they able to use the data? Can they interpret it, and can they use it for maintenance actions? And similarly, the other one that the other challenge that is usually faced with RTMDs is the fact that given the fact that they're based on cellular connectivity, there are challenges with network connectivity in some of the places where these devices are deployed. So it becomes a challenge in transmitting the data to the portal and having that access, especially to remote areas where these systems would very well bring a lot of value. Especially where like technicians are not able to reach, but still maintaining that kind of visibility. So another challenge that has been seen is also the fact that while the data exists, the ability to use analytics for decision making, that culture is not yet ingrained within users. So that still means that data is not able to be used to make those decisions that countries can make around maintenance. Now, one thing we wanted to highlight around data ownership and access, and this is something that GAVI has updated in 2020, just to make sure that at least across the board, countries manufacturers and every stakeholder involved is aware and is up to date on the ownership, on the data ownership principles in terms of the data that is coming from the equipment, the cold chain equipment. So GAVI's position around this is the fact that countries actually do own this data, and this data in terms of ownership, we're looking at them being able to define who has access to the data, which third parties can use the data, how it is stored, how it is stored, how it is transmitted, and also how it is used within the different stakeholders. But again, this doesn't limit the fact that manufacturers still need access to this data to be able to implement warranties, but to also be able to make any product improvements that are needed based on the actual field performance data that is coming from countries. So that's something to emphasize on with countries, that to try to reduce that barrier that countries are seeing in terms of access. But again, in terms of when you look at all the GAVI support that is going out to countries, be it CCOP, the cold chain equipment optimization platform, or the health system strengthening support, this principle carries across all the funding streams, or all data, or all funds, or all equipment that is funded by GAVI. So specifically for CCOP, data ownership in 2020 was updated as an eligibility criteria. So meaning that if a country is, if manufacturers are providing this, the equipment, and countries are buying this equipment using GAVI's funding support, irrespective of a stream, this principle applies. Over to you, Ranjit.
Thanks so much, Jalia. So I'm going to talk a little bit about programmatic consideration for RTMD implementation. So in short, if we speak about planning for RTMDs, it is supposed to be linked to the immunization supply chain strategy of the country, long-term strategy where maintenance is an important component, and using RTMDs for sake of maintenance. So to implement RTMD, we need to be considering about the financing part, the long-term cost associated with procurement of the devices itself, and as you heard Jacob saying, there are cost of maintaining the networks and SIM cards and internet, etc. So that's one. And then we also need to be considered about data use and systems, which includes basically how do we monitor the fridges and link it to the maintenance as a broad strategy, as I mentioned at the beginning. And then human resources. So the training part, who's going to use the RTM as a focal person to really monitor and shoot out let's say key reports from the RTMD, for example, at the central level or the district level, because RTMD is accessible through dashboard. So somebody need to be monitoring it, using it, and those kinds of training aspects has to be well planned in the country. Not only from the, let's say, programmatic side, but also from the data side, who's going to manage the data, etc. And then, of course, big picture is leadership. Resource mobilization, ensuring this is one of the key priority within the maintenance plan to fund, consistently fund RTMDs, and of course there's a political will to adopt RTMD for this. So having said that, I would invite our colleagues from Tanzania to hear from them of their experience using RTMD in the country.
Thank you, colleagues. This is a very wonderful discussion, and we hope to get much from it. In Tanzania, we managed to install more than 5,000 RTMDs, which are mostly the cold trace devices at various levels, including the regional level, district facility levels. And by this moment, we are also installing the RTMDs at central warehouses in Dar es Salaam. We're grateful for the JSI and the Nestory, the Ministry of Health. In collaboration with these partners, we are managing to train the district and the region immunization focal persons who led the installation of these devices at the facilities and the vaccine storage warehouses at their offices. So as you can see from the presentation slide, we started this process in the end of the year 2017, where we trained some divos and derivos in Tanzania. And in the end of the same year, we managed to start installation of these devices. As the timelines went on, we started also the second phase of training for some districts and the regions, and managed to went with it until the year 2019, where as the Minister of Health, we had some negotiations with the customs authorities to import or to find the clearance to file up the clearance processes so that we can import these devices into our country. And by the end of the year 2020, the installation process all over to many regions. By this moment, we are through with the training and installation of devices, and most of the devices are installed in the facilities. Next slide, please. This is the map of Tanzania. As you can see, we have different phases of installation of devices. The green color shows the installation of devices in the first phase, where we had almost 7 regions, the Kagera region on the northwest part of the country, Mwanza, Tabora, Shinyanga, Dodoma, Morogoro, and Dar es Salaam. But also in the second phase of the installation, we had almost 13 regions, making a total of almost 20 regions. We still remaining with some few regions in the mainland, but also in Zanzibar, where plans are undergoing to procure and install RTMDs at health facilities and the district and the regional stores as well. Next slide, please. This is the highlight of the way we went through with the implementation process, whereby, as I said earlier, district and the regional immunization focal persons were responsible for installation of the devices after training. The good thing is that these remote temperature monitoring devices were integrated into the vaccine information management system, whereby currently these regional officers have only a single login into the system. So through the single login process, they are able to view the stock management systems as well as the temperature monitoring system dashboards through the single login. During the implementation, we had data costs which were covered by these facilities, and because of the changes in the budget system, these facilities are now responsible for allocating funds for data which are used to send the funds which are used to send data to the dashboards. And during the implementation also, we had some adjustments to ensure that the whole process of data for installation, data sending, and the maintenance. And along the way, we had also, as I mentioned, we had shifted those who included the RTMD installation to work in boardrooms at the central level. Due to COVID outbreak, we had to adjust the training processes, whereby initially we were calling the groups of divos and revos in one training session, but due to COVID, we decided to put them in smaller sizes, whereby the national officers had to go to visit the districts and regions where the training were took place to very few number of divos. And health facilities were responsible for site readiness for installation. For example, they had to buy sockets and extension cables where the processor, where the installation the RTMD has to be taken quite far from the existing socket. The divos also had to be reimbursed after installation of the RTMD. And one thing we had to do is that to ensure that once the device is working and sending data, it's only the divos were supposed to be reimbursed for the expenses they got. The district facility took over responsibility of payment for data and SM cost, as I said. And during this process, we encountered some hiccups where we find out that some devices were not just sending data. So this is one of the challenges. Also, we experienced a challenge of changing of the regulations through the National Regulatory Authority. So this also was a hiccup. So we had some difficulties during the implementation. Next slide, please. So during the implementation and other processes, all in all, we have some benefits from this RTMD installation. One good example of it is that installation of these devices drives immediate action for healthcare workers and the district level officers. Whenever there is a temperature excursion, it is simple for the manager or the supervisor at the district and region level, as well as the national level, to detect that excursion and make communication with the facility, the healthcare worker at the facilities, so that the excursion can be corrected. But also mainly at the country level, the national level, the RTMDs provide an assistant for managers at central level to foresee the maintenance as well as the spare parts, which are mostly needed, because they can be able to see what devices are breaking or are recording various temperature excursions. The benefits of RTMD at the global level, as you can see, it contributes highly to the global data set, which can be used for evaluation of various CCE performances, and these all together can lead to or can direct the procurement and maintenance decisions at the global level. Next slide, please. During implementation, we had observed some experiences and whereby the district implementation focal person through the RTMD dashboards, as you can see on the slide, this facility had reported a very low temperature data, and the dashboards which the DIVO has access to were able to notice it, and because of this, so the DIVO notified the facility, and the health worker adjusted the thermostat. So DIVO and the other supervisors can be able to do supervision without going to the facility, and it makes these devices functional. Next slide. At the national level, as you can see,
Bonaventura, we need to wrap up. Can you please? We are a bit behind of time, so we need to wrap up, please.
Thank you, Alex.
Sorry about that.
Thank you so much. So all in all, what I'm saying is that the RTMDs provide a visibility to various CCEs which are installed at the facility level and on the stores, which enables decision makers, those levels to see what can be done to ensure that vaccines are properly stored, and also to see the vaccinality of the CCE and make procurement of spare parts which are responsible when needed to make sure that they function well. This also is a one slide which shows the challenges which we encountered. I think most of them have been saying, but as you can see the figure in the middle, as the installation process went on, we had encountered some challenges whereby some devices were not sending data. So this is a challenge, as you can see. Next slide. So these are the lessons which we learned as a country. One of it is that we managed to engage these telecom companies, whereby by the existing SIM cards, which was a challenge previously, we now have the machine-to-machine SIM cards which can be used to these devices. So now I think there will be no barrier. Visibility at the facility level, we made some communications with health facilities and the management of the health facility to ensure that data are being observed. So if it would be a good opportunity for decision making at the health facility level themselves. So yeah, I think we we are now good with the installation, we can go on to ensure that the RTMDs are functioning well and they can be used in other countries as well. Next slide, please. This is the global value of RTMD installation, and as you can see, the RTM data allows country to objective RTCC, as I said earlier, and the combined data set, which are provided by these devices, provide countries the opportunity to compare
So, do you hearing us?
I think we lost Bonaventura. We lost Bonaventura. I think his connection was not too good. So perhaps we can carry on. Jalia, what is the next slide? That's the conclusion. Okay, so let's carry on. And I think, what is the next slide? I think it's yeah, Afghanistan. So Afghanistan, you can start your presentation. Thank you very much.
Oh, okay. Yeah. So thank you. Very good morning to everybody. And this is again my pleasure to be with you people. My name is Dr. Gulakhan Ayub. I am working as a National API Director. So thank you very much for giving me this opportunity. Our cold chain system is, you might be aware, Afghanistan is a landlocked country at the Central Asia. And it is geographical location is hilly, mountainous, and even for more than 6 months, there is snowfall, and the road is almost black. In some areas, we do have very high climates, temperature, like in the summer season, it goes to around 45 degrees Celsius. So we do have a lot of problem here in Afghanistan. You might be aware nowadays we have faced with the tragedy. Our banking system is impaired, and and even we have no access to the routine vaccination, because our flight system is also damaged with the other countries, and even we are chartering flights from Dubai to Afghanistan, and this is very costly. And thank you. This was my general concern. Now I would like to give the floor to Mr. Mateen, who is our national cold chain manager, to explain about the Afghanistan context. Thank you. Over from my side.
Okay, good evening for all of you. As I introduced myself, my name is Abdul Mateen, National Cold Chain Manager. Now I would like to explain the category of cold chain in our country. You know, we have 4 categories in our country for vaccine storing and distributions. One is a national vaccine store. We have 9 WIC refrigerator and 2 WIF. In these 11 working cold room, we are using 6 RTMD behind wireless systems. In the region, we have 7 regions in our country. In that 7 region, we have 14 WIC and 9 WIF. For all of them, we are using 13 RTMD behind wireless systems. That in the next slide, which is presenting by Chidi, you will see that how temperature, when, where was the pulse, where was the positive thing. That's, and also 27 provinces. For these 27 provinces, stores, vaccine store, we are using Iceland refrigerators. For these Iceland refrigerators, we are using 30 DTR systems. 30 DTR systems that also we are managing from by DTR devices. And we have in our country 2,618 health facilities that belong to government and also including with private. Approximately, we have
I'm sorry, Mateen sir, we need to speed up. We are very much behind.
Okay. Approximately, we have 1,088 SGD with RTM. With the RTMDs. These SGDs provided by HSS 645 SGD from HSS budget and 406 from CCOP proposals, and also 35 SGD purchased from polio section. That's now I'm giving I'm hand over the presentation to Chidi. She is a cold chain specialist, and also to Dr. Wazir.
Okay, thank you very much, Dr. Mateen, and Dr. Kulahan for your introduction. So as we have heard that Afghanistan has faced a lot of challenges, both politically and otherwise. But despite the challenges Afghanistan has faced, they've been able to manage their temperature monitoring systems for the cold rooms and the SDD very well. So, and this was clearly shown in the recent temperature monitoring study that was conducted in the country in 2019-2020, where 99% of the hours the vaccine was traveled from the national store to the last mile, the vaccines were kept at +2 to +8 degrees centigrade. So during the winter period. So having said that, so the country has remote temperature monitoring systems for monitoring the cold rooms. So as you have been briefed, we have the national store and about 7 regions within the country supply chain where these cold rooms and working freezers are installed, and a total of 21 beyond wireless ICE3 devices are also installed in this region. So next slide. So this is what the dashboard looks like for Afghanistan, showing the locations of the beyond wireless systems in the country. So as you can see, each circle shows the location of beyond wireless in each of the 7 regions. For Kabul region, the Kabul region shows beyond wireless in 2 places, which is the national store, which also acts as the regional store, as well as the airport, because we have some cold rooms at the airport for emergency vaccine storage. So the beyond wireless system are installed in all these regions and the national, and also the national level. Next slide. So what the mechanism the country has been using to monitor and control these remote temperature monitoring devices. So the country has a pool of dedicated staffs that we are trained on the use of beyond wireless by the I3 Extra company during the installation. So these dedicated staffs are located at the regional office, vaccine stores, and the national stores. And they monitor the temperature readings from this working cold room and working freezers on daily basis. And of course, the national focal dedicated staff also coordinates and monitors and analyzes all these beyond wireless data centrally from all the regions in the country. So in case there is any alarm, the beyond wireless system sends alarm notification to the mobile phones and email addresses of this dedicated cold chain staff, both at the regional level and at the national level. And immediate actions are initiated immediately by the cold chain technicians at the level where these alarms originate from. So next slide. So these are an example of reports we get from all the locations where beyond wireless is installed. As you can see, on the right-hand side, this is last month, which is in October, report from the Maza region, where we have our cold rooms connected to the beyond wireless system, and as well as the other, on the left-hand side is a weekly report from one of the cold rooms in our Kabul station here. So these reports are usually printed and signed and filed appropriately by this dedicated staff as part of the EVM compliance. So next slide. So like I said before, alarm stages are in three stages for us. So immediately an alarm, a temperature excursion occurs, an alarm is sent to the stage one is sent to the regional cold chain technicians and also the responsible EPI manager there. So if action is not taken and if the issue is not resolved immediately, after 15 minutes, the alarm notification goes to the next stage. So and at that stage, all the technicians involved at the level where the alarm comes from are notified and immediate action are initiated immediately. So next slide. So this is an example of an alarm episode that occurred in Kabul last week. So as you can see, the stage one, the notification was sent immediately to the designated staff and at the Kabul region. And also action was not taken. So the next stage was the national region. As you can see, the name of the EPI manager. So immediately this was sent, action was initiated immediately. And the technicians were sent to notice what the problem is, because the temperature was showing that the temperature of the machine was showing that the temperature reading is not going below -10 degrees centigrade. So, and they observed that the cooling unit is malfunctioning. So they had to replace the cooling unit immediately because we have a stockpile of spare parts of this equipment. So after the issue was resolved, the equipment started working perfectly. Next slide. So this is also another example from Gades region of working cold room located there. So this cold room here was not transmitting data for more than 25 hours. So an alarm was sent immediately to the regional cold chain technician as well as the national cold chain technicians, because the national cold chain technicians also get notification for every alarm from any region. So action was also initiated immediately. Let's see the next slide. So action was initiated immediately to the cold chain technicians that are trained and situated in each region to go and observe and check what the problem is. So they were able to find out there was a leakage of gas in that equipment. So the national focal person has to liaise with the cold chain technicians at the national and the regional level to solve this problem immediately. As you can see the date, the alarm was sent on the 16th, an action was initiated immediately that 16th and that May 17th. Next slide. So that is how the remote temperature monitoring for working cold room using the beyond wireless system is being done. So we also have the SDDs in the country, which are installed in all our facilities, and also they are integrated in the B Medical remote temperature monitoring system. So next slide, let's see how we monitor this. So this is a map showing all the installed SDDs at different locations across Afghanistan. As you can see, each of these dots, each of these balloon-like shows each SDD. So you can see the green color shows that the equipment is working optimally, but the other colors like red, orange, blue, purple shows that there is a problem with this equipment. And for each of these equipment that has been manufacturing, an alarm is sent to the concerned coaching technicians, and the actions has also been initiated with the B Medical agents in Afghanistan by the name Kurishi Group, who are responsible for managing and resolving every issue that has been initiated or has been communicated to them concerning this equipment malfunction. Next slide. So we also use this B Medical remote temperature monitoring to track when an SDD is commissioned under the delinking methodology. The linking methodology simply means that the country has trained cold chain technicians that install this equipment instead of the B Medical. Because of the country peculiarity, this consideration was given for Afghanistan. So when an equipment is installed in a new location, requisite data are collected for that installed equipment and entered into the B Medical portal immediately. And the temperature record of those newly installed SDDs are monitored during the cooling down period and upwards while the equipment functions. So any malfunctioning that is noticed within this period is communicated immediately back to the technicians involved so that this can be addressed immediately. So the B Medical temperature monitoring system also accepts 3 email IDs to communicate alert in case of any malfunctioning. And these are in 3 levels too. From the lower level, that's the health facility where these equipment are installed, the regional level and the national level. But the challenge we have is that in some of these health facilities, the health facility staff do not have functional email addresses. So we have to use the provincial email addresses of the coaching technicians who are closer to those health facilities. In case of any equipment malfunction, they will receive the alert immediately and take the requisite action. So anytime there is temperature excursion, alarms are sent to these 3 integrated emails, and all levels are mobilized to take action immediately. Let's see the next slide to see how we coordinate these actions when an alarm is sent. So this is an example of an email from the data logger or on the backlog system showing an alarm system from a region in Guza Health Facility in Kabul. So when this email is sent, the focal person at the national level that coordinates the CCOP equipment immediately communicates to the Kurishi Group, who is the B Medical agent in Afghanistan that manages the repair or resolving any issue emanating from this equipment. So let's see the next slide. You can see the email communication there. So this is another example of an email alert from 2 locations showing internal low temperature. So the one on the left-hand side is from a Kirimdad Health Facility in Maidan region, and the other one is from Bayan region. So you can see the CCOP coordinator writing immediately back to the Bayan team to also cross-check the internal low temperature with the fridge tag inside the fridge to collaborate whatever the alarm is saying. And also on the left-hand side, you can see the communication he has passed on to the Kurishi Group, indicating the location where this equipment internal low temperature alarm has been sent from. So in all and all, we compile all these alarms we get also in a tabular form. In addition to sending the biomedical agent an email, we compile it in tabular form and send to them so that they will have a comprehensive view of all the equipment that are malfunctioning and also plan their movement to go to this site and resolve these issues. So this is what we have been doing to get our equipment working optimally across Afghanistan. Next slide. So I will hand over to my colleague, Dr. Waziri, to continue with the presentation from this point.
Thank you, Chidi. May I request quickly, speed up the thing, please.
Okay, thank you, Ranjit. You will speed up. Thank you, Chidi. As she mentioned, we have some challenges with the biomedical RTM system. The first one is that the system is supported by the SIM card, and they are not sending the text message. And also they need the global mobile system to be available. In some area, the global mobile system connectivity is not really, if it is not available, we cannot connect data logger with the portal. This is one problem. And the other one is, as I mentioned, the biomedical system are not supporting the text messaging. In our country, in most of the health facility, there is no email availability. So the text messages cannot be sent to the end user vaccinators to take action on time. So as Chidi mentioned, the message went through email to the provincial coaching technician who is nearby to the health facility, and he is taking action accordingly. The other thing is, the other challenge is we don't have practical training for the cold chain technicians on the SDD maintenance. And the medical agents who is Quraishi group is also slow in response. If we receive any alarm from the field, so the response is slow. Nowadays, we have started communication with this Quraishi group, and we have a meeting with them. We hope that we will explain the process, and the SDD will be repaired on time. Next slide. So in conclusion, the RTM is help us in the following things: evidence-based commissioning of the SDD according to our operational deployment plan, document recording of temperature of EVM complaints, because they are printing the temperature for 2 months, and they are recording it in the file for EVM assessment. Targeted intervention to see vaccine in fridge by timely monitoring and corrective action. When we receive the alarm, immediately we are taking action, and the culture technician is going there and solving the problem. Also, we are feedback to the manufacturer and PQA secretariat on the performance of the fridge and model. We have one example of that in some of the SDDs, as they are grade A, but still in some SDD, the temperature is going below 0 degree. And we have already communicated this with the manufacturer. And thank you very much from outside.
Thank you so much. We have just a couple of minutes left, so probably we can take the questions in the Q&A to give a few responses before Alex is able to wrap it up. One question is around whether there are any WHO certified suppliers providing an RTM solution that fulfills all the WHO requirements and functions using internet service instead of the 2G or 3G network. Yahoo, over to you on this one.
Thanks, Jalia. Thank you for the question. So most of the RTM systems that are on the PQS list, they use 2G or 3G to transmit the data. There are one or two systems that is capable of using Wi-Fi to transmit the data, but I would suggest that you get in touch with the supply division team for a bit more guidance on that. The PQS pre-qualification asks for 2G and 3G capability, but for Wi-Fi, you can reach out to the ST team.
Yaku, your sound is really going off. So yeah, maybe you can take a look for any potential next question, because we couldn't hear much. I mean, at least on my side. Thank you. Jaya, you can carry on.
Oh, okay, thank you. The other question is around what are some of the possible actions taken by healthcare workers? I think we've seen that in these slides a bit, but again, there's if there's anything to add beyond what has been presented, Ranjit, beyond what has been presented in the different presentations in terms of the use cases for the data that countries can use, how countries can use this data beyond what has been presented.
I'm sorry, Jalia, you're referring to the second question, right? What are some of the possible actions taken by health workers? Yeah, so of course, the first what we heard from Afghanistan, that the information on RTMD is essentially monitored by a central team or the provincial team, not really too much by health workers to start with, because they're not getting the SMS alarm. Health workers are using 30 GTRs to monitor the fridge, and I would say it's the coordination which is triggered. I mean, that's what the RTMD do. It triggers need of coordination between health workers, technicians, and the entire network for the maintenance. So I think, yeah, that's all it does.
Thanks, Ranjit. Another question is around how to activate the integrated biomedical VAC log. I assume in case it hasn't been activated post-installation. Jacob?
Jalia, maybe I can try again. Is my sound better now?
Yes.
Okay, great. So great. So just quickly on the Wi-Fi earlier, some RTMD systems can do the Wi-Fi transmission, but I would suggest that you get in touch with the supply division team for further guidance on that. Then on the pre-medical vaccine guard, I would suggest that on the activation of the B-Medical backlog, that you get in touch with B-Medical for direct guidance on the best procedure to activate that.
Yeah, Jacob, maybe I can answer. So that's what, yeah. So the process is that when you have to register the STD with B-Medical, with giving a serial number of RTMD, serial number of fridge, and the location. That way, and then that way the fridge gets registered and it gets activated.
Thanks, Ranjit. I'm mindful that we are right on time. I'll hand it over to Alex to help wrap us up.
Thank you very much, Chad. Thank you, everybody. That was a very interesting presentation in total. I would like to thank you, all the panelists, for their time and engagement. As a reminder, I will send you the links to the recordings, to the recording and the slides by email, and they will also be made available on the TechNet 21 website. I already shared the link in the chat box, but I will send it by email anyway. Next week, we'll discuss equipment monitoring systems, the future of interactive cold chain performance monitoring. Same time, same place. You don't need to register, as you've already registered for this session, so you will automatically receive a notification with the link to join the call. Thanks again, everybody, and we hope to see you next week. Have a good rest of the day and stay safe. Bye-bye, everyone.